Hello, and welcome to our quick QI webinar series on driver diagram. My name is Alex Clement, a QI coach with the Excellence Through Quality Improvement Project, and I'll be joined shortly by my colleague, Laura Daly-Trottier. And here's our agenda for today. We're just going to quickly go through what exactly E-QIP is, the model for improvement, theory of change, family of measures, and then the item of the day, the driver diagram. So the Excellence Through Quality Improvement Project was really born out of a need that was identified within the mental health and addictions sector, and that was a need for a shared culture and language around quality improvement. So E-QIP is guided by 4 principles, including providing clients and families with the best service possible, promoting the optimal use of resources through quality improvement, supporting our dedicated and skilled service providers in their work on behalf of clients, and striving for mental health and wellness for all Ontarians. So in its essence, QI is really a method of continuously finding better ways to provide better client care and service, going from good, better to best. So it's a systematic approach leading again to those better client outcomes, stronger system performance, and enhanced professional development. And it really draws on the efforts of all who are involved, including the healthcare professionals, the clients and families themselves, researchers, planners, and educators, in order to make sure that these improvements are sustained. And the way that we, as the Excellence Through Quality Improvement Project, hope to achieve this quality culture is through using 3 frameworks, including the quadruple aim, which you can see on the right side of your screen. And this is really the why that we're trying to do all of this work. And it's making sure that improved patient experience or client experience, making sure that clients are experiencing improved outcomes overall, improving the provider experience, whether that be the frontline service providers, volunteers, etc., as well as lowering the cost of care. And we hope to do that through improving things within the domains of quality. So you can see here the 6 domains of quality being safe, client-centered, timely, efficient, equitable, and efficient. And on the left-hand side, we see the model for improvement, which is really our how we hope to accomplish this. And the model itself is 3 questions and a cycle that guide our way of doing things and our way of applying improvements overall. And if you've watched any of our previous quick QI webinars, you'll probably be familiar with this visual on the screen now. So on the right-hand side, we have the foundations to QI stage and tools, as well as the model for improvement, sort of superimposed next to it. So you probably would have heard about preparing for QI, understanding the problem at hand, measuring and understanding your system, developing and planning solutions, testing and implementing change, as well as sustainability and spread. So while talking about the driver diagram, you'll kind of see that it'll land into this developing and planning solutions area. So at this point, you likely would have developed your problem statement, worked through the diagnostics, and determined a list of contributing causes to the problem, otherwise known as root causes. Now would be time to start generating some creative change ideas. And first of all, before doing that, you'd want to talk about visualizing that theory of change, which leads us to our driver diagram concept. So when considering a theory of change, it's really an approach to help build and empirically test theories for improvement within a given process or system. So that process or system would be where you've identified the problem or opportunity that you would like to improve upon. So the theory of change really requires teams to consider the why, which is your rationale for making changes, as well as the how, meaning what structures and processes or norms are going to require changing within that system, as well as how you hope to change those processes and structures through the application of specific ideas. So the idea of this theory of improvement calls for experience and knowledge to justify actions, otherwise known as reason giving. So we're going to do X because of Y, or we've done Y because of X. So it really hopes to facilitate the planning and executing of change within your system or process with the greatest possible impact, and guides the continuous process of prediction, testing, and learning in order to revise and work towards your given aim. Why would you want to use a theory? Well, there's a couple of key points. Often there's a lack of evidence regarding how to achieve a desirable or a desired outcome within the system of interest. So if we knew right away how exactly we would want to change things, usually we would act on those things right away versus kind of working through the whole diagnostic system as well as planning change ideas. So this is usually because, again, there's that lack of evidence existing already. It also enables a project team to predict what changes can you make that will result in an improvement based on research, observation, and our experience. And you'll recognize this question probably from our model for improvement. The application of a formal theory also maximizes learning and accumulation of knowledge and really helps promote the transfer of learning from one project to the next. So not only are you creating some improvements in your system or process, but you're learning through that whole way of doing things, and you can take that knowledge and apply it going forward. So keeping in mind that while you're considering what changes can be made to result in an improvement, it's really important to work closely with subject matter experts who work directly with the system of interest when theorizing what changes could lead to that improvement. Oftentimes, teams might fall into a common QI pitfall, and that's not having a theory for intervention, meaning that changes are being planned and tested. However, they do not relate directly back to the underlying causes of the target problem. So those root causes that you would have identified during your diagnostics. Now, of course, it'd be helpful to have a tool to help theorize this theory of change and plan for change ideas, which brings us back to our project charter. So you see here in the circled area, we've identified those change ideas and process measures that are going to be linked directly to the root causes that were identified. And of course, this brings us to the tool of the day, driver diagram. I'm going to pass it over to my colleague, Laura.
Hi, Alex. Thank you so much. So if we align the model for improvement and the theory of change, we can then begin to think about what changes we can make that will lead to improvement. Again, these are the theories or hunches, if you will, that we believe will yield the results we are aiming for. Having said that, as the slide says, not all changes lead to improvement, but we can't improve without change. So what are the key pieces that will drive the change in theory? So one of the tools that we can use, of course, is this lovely driver diagram. And so over the next few slides, we're going to walk you through some of the pieces and things to consider as you are developing and structuring your own driver diagram for your own initiative. So by placing the different ingredients of your project on a driver diagram, you can create a visual roadmap to develop and communicate how you're going to achieve your goal. It answers the questions why and how. And so why are you testing a particular change idea, and how are you going to achieve that goal? And linking, as Alex mentioned, the root causes of a problem to the proposed change ideas, and following along in that logic model. It also identifies the hypothesized relationships among the primary and the secondary drivers of change. So if you make a change to a part of the system, what effect will it have on the outcome? Which leads nicely into measurement as well. So when you're developing your driver diagram, including measurement, either process measures, balancing measures, and or outcome measures, those are the kinds of measurements that you will want to keep in mind as you develop. And we'll talk a little bit more about that in a few minutes. But this tool also provides a way of systematically laying out aspects of an improvement project so that they can be discussed and agreed on collaboratively by the project team. A driver diagram is framed in the positive as compared with a fishbone that you would use during your diagnostics that would be framed in a negative term. So driver diagrams are a nice, refreshing view using those positive statements. And again, just using a few words to describe a driver, not full sentences, keep it succinct. And you'll notice we have a little bit of a quick tip sheet here on the screen, which can be helpful. The big dot system aim on the left-hand side So the big dot system aim is that larger strategic direction that the organization is or agency is working towards, either at program level, could even be a big dot aim, or at the organization level or at the system level. I guess it would depend on the complexity of your project. And also your system aim would be linked to one of the six domains of quality. The primary drivers are the ingredients that must be present in order to achieve the aim. They are at a higher conceptual level than the secondary drivers. And the secondary drivers are at a higher conceptual level than the change ideas. So maybe more than one secondary driver for each primary driver as well. Once you have the secondary driver, look at those and think about how they cluster or affinitize, and whether there is a conceptual way to aggregate up from the secondary driver to 1 to 3 or 4 primary drivers. Consider reframing the root cause in a positive way as a secondary driver. That's another nice little tip that we found very helpful. So taking, again, those root causes that are framed in the negative and flipping them and reframing them in a positive way. Include descriptor words, so lack of understanding, reduce repeat errors, so that it's easy for people to understand and follow the logic. Now your change ideas may be more than one change idea for each of the secondary drivers. You may have 2 or 3 change ideas, dependent upon the complexity of your project. And based on the root causes identified by the team, the client inputs via surveys or experience-based design, for example, those may help you identify areas of change concept and then more granular change ideas. Process measures are able to attach a process measure to each change idea and or secondary driver. So again, as you're working through your driver diagram, it is your project and you're wanting to measure to know whether the changes that you have proposed are actually improving in the outcome. And these are often articulated as percentages as they address the fidelity of the change idea. So that's a little tip sheet. The next slide here, we have a driver diagram template that people can use to populate their own work. And of course, we have the primary, the secondary drivers, as well as the change concepts and change ideas listed off as the sections of the driver diagram. On the left-hand side, we list our aim as we currently understand it. You can create the driver diagram at all levels, and what I always suggest is to create one using the system level aim in the left box, and then once you have worked through the driver diagram for the system aim, then do a second one with your project level aim on the left. And no matter which way you do it, the primary drivers are the ingredients, if you like, that must be present in order for you to achieve your aim. And the first, how. And then the secondary drivers are the ingredients that would allow the primary drivers to be true, the second how. And likely your project aim comes from one of the secondary drivers and sometimes from a primary driver, depending on the level of the driver diagram. You don't always have a secondary driver. We'll just add that in as well. So when the theory is very clear, it may only have a primary driver. There is no second how. And then you have your change concepts and ideas. And when you read a driver diagram from the left to the right, it answers the question how. And when you read it from the right to the left, it answers the question why. So this slide also demonstrates the theory of change. So starting to populate your driver diagram at the secondary drivers may be helpful, linking the results coming from the process map analysis and or Pareto chart root cause analysis to the secondary drivers, reframing them in the positive. Then looking at the change ideas, those are the granular tasks that will answer the question how. So let's take a look at a practical example. So if we go back to our roadmap or go through this roadmap, for change ideas related to increasing the number of steps and thinking about measurements. So what we've done here is we've created a driver diagram using a regular everyday thought around perhaps somebody wanting to increase the number of steps per day by 80% by December 31st of 2019. And a primary driver for this would be to increase physical activity. And the secondary driver would be to develop behavior changes. And then the second one would be to implement structured exercise routine. And then change ideas that might come off of these two secondary drivers would be talking about walking, so increasing the number of walks I do. So to my friend's house, walking to work, walking during my lunch hour, walking during phone calls, getting up 30 minutes earlier on a daily basis to allow for extra time to do the walk to the workplace. And then for the exercise routines, adding in some structure around the number of runs or walks per week that exceed or are at the 45-minute mark. And then spinning classes was another idea. And we've actually added in the outcome measure here to show what it is that we're going to be measuring for the long term. So how many steps a day are we taking? And what is the actual and what is our goal? And on this next slide, we're going to talk about change ideas and the process measures that you might attach to that related to your driver diagram and the work that you're doing there. And so if you look at, for example, the walking to your friend's house to talk rather than to text, I would then be using a measurement of the number of times I've done that in a given time period or in a day. The other one would be the number of times I did a run per week, so change idea number 6. And then the spinning class, the number of spinning classes per week. So as you can see, you would, by measuring your processes and your change ideas, you could then start to see which ones were working, which ones had a stronger uptake, which ones were easier. And then also looking at your outcome measure, have those change ideas actually increased the number of steps? And then plotting this out on a larger driver diagram, you could see, you could easily communicate the logic between the change ideas and the aim or outcome. So I'm going to pass the slides back over to Alex, who's going to take us through an example of a driver diagram from the mental health and addiction sector.
Thank you, Laura. And as you can see now on the screen, we've gone from our lovely driver diagram explaining how we would increase our number of steps per day to a slightly more complicated driver diagram that relates to the mental health and addiction sector. So depending on the project at hand or the system or the processes involved, driver diagrams could, of course, get a lot more complex. They may have more primary drivers or secondary drivers, etc. This one, for example, on the screen now has a new level of tertiary drivers. So they were able to go from one primary driver, which split into two separate secondary drivers, each that had tertiary drivers attached to that. Now, that's not to say that every driver diagram should have tertiary drivers. Really, it'll depend on the complexity of the project and system that you're looking at. So each of their tertiary drivers in this example has a change idea attached to it. This project had the aim of, by September 2019, the average score in participants' life assessment scores will increase by 25% from baseline. And then below that, it had a longer term goal, maybe a big dot aim of, by September 2020, 50% of participants will achieve an increase in financial self-sufficiency, higher education, and lower reliance on social assistance from their baseline levels. So attached to those, you can see the numbers, sort of an annotation. There's 1, 2, 3, and 4, and it has the outcome measures on the right-hand side in that sort of legend of measures. So again, this is just another way of demonstrating how you can organize your driver diagram with the measures being kind of charted all on the right-hand side with annotations throughout. Laura shared with you the earlier driver diagram that had little circles sort of attached to the areas that they related to as well. Again, no wrong way to do this. There's kind of unique driver diagrams for every scenario. So you'll also see with the secondary drivers, they have 5 and 6 superimposed on those, and you can tell that they relate back to the measures in the chart of intermediate outcomes or lag process measures. And then at the end, we also see 7 through 10, which are our lead process measures attached to our change ideas. So kind of answering the how and the why, if we worked from left to right, we see in order to achieve that aim statement, the primary driver is knowledge of 9 areas for personal growth. The second driver being achievement of personal goals to attain self-sufficiency and life skills. Well, how are we going to do that? Broken down to the tertiary level, intentional friendships, as well as coaching support, which each have their own change ideas attached. So for the intentional friendships, you'll see they're going to try out testing monthly support and meeting with an ally. And with the coaching support, they're going to look at a change idea of weekly one-to-one meetings to assess progress on goals. And again, those have percentage measures attached to them to see how the fidelity of those change ideas is going. One slide too many, sorry about that. So as you can see, when our driver diagram got a little bit more complex, we saw the addition of a few measures. Again, these may or may not be appropriate for your particular project, but they're definitely options that are available to you if needed. So this particular project had an intermediate outcome measure. So in some cases, the outcome measure is going to be very high level, and it could take a significant amount of time before you're going to observe progress. So for instance, this would be considered a lag measure. So you're doing a lot of work up front, hoping that you're going to make those small incremental changes within your process measures and that they're ultimately going to have that downstream positive effect on your outcome measure. However, as stated, if it's very high level, it may take a long time before you start seeing those noticeable changes at that kind of overall umbrella level. Things like quality of life, prevalence of a certain illness, or readmissions to hospital could be considered those kind of high-level outcome measures that are going to take a while to achieve, and probably a lot of different change ideas are going to have to be tested in order to make some measurable progress within those measures. So in those cases, you would want to maybe put in an intermediate outcome measure, such as achievement of personal goals or symptom prevalence that's attached to a primary or secondary driver. This way, you can still measure progress that's being made and demonstrated as changes are occurring before being seen in that overall outcome measure. There's also lag process measures. So these aren't necessarily outcomes and are not going to be a reflection of the fidelity or uptake of a change idea, and could be things like availability of time slots in a schedule or number of clients. So again, those wouldn't be the things that you measure right away, but something that would kind of lag and be noticed a little bit later on. So if you're considering, you know what, our change idea was training staff, we can measure right away how many staff were trained, but it may take a little while to see how they utilize that training down the line. So kind of consider that as your lag process measure. And here we are again at our Foundations to QI stages and tools. We were able to share with you, hopefully, the importance of a theory of change or theory of improvement, kind of answering those questions, how and why we're looking at making certain changes and what changes we're hoping are going to lead to that improvement. And then creating our visual representation through a driver diagram in order to demonstrate that theory. if you found this webinar helpful today, I would strongly suggest that you check out some of E-QIP's quick QI webinars if you haven't already, leading you through that QI stages and tools process, everything from how to prep for QI, creating your team, diagnosing problems, testing change ideas, etc. And that can be found on the E-QIP Ontario YouTube channel, so please check it out. Here are a few other webinar series that are separate from the quick QI webinars, but still very much helpful and related to the mental health and addiction sector. We've highlighted and starred some of our favorites. And if you are ever interested about more quality improvement or QI information that relates to the mental health and addiction sector, please feel free to reach out to our E-QIP staff, Debbie, Ashley, and Amy. They'd be more than happy to help you with any questions that you may have. We'd like to thank you so much for your time, and thanks for joining us today, and we hope you learned something. Have a great day.